We are back here at Beaufort Memorial Hospital, and Jackie Brown has joined us. You are an RN. You're also clinical manager and director of the Beaufort Memorial Breast Care Center.
Because you all had a recent name change.
Well, yes, thank you for rescuing me with that. I was like, oh my gosh, it's the Imaging Center. No, it's not anymore.
So when we opened, we were called the Women's Imaging Center of Beaufort Memorial, but we have had a name change, and our new name is the Breast Health Center.
What prompted
at
the
Beaufort
change?
Memorial. The change came about due to all the program changes that we've had with getting accredited through the National Accreditation Program for Breast Centers and our Breast Center of Excellence. So we're a more comprehensive breast center.
Talk to us a little bit about mammograms, about what your machines are like there, and spoken from someone who's about ready to have a mammogram, a little bit about what, Erin, you can expect.
Okay.
Look at Erin's like,
So,
Thank you, Debbie.
you're welcome.
so to give you some comfort,
welcome,
we have a state-of-the-art machine. We have the best technology available at Beaufort Memorial. We have what's called 3D mammogram or tomosynthesis. And the way that mammogram works is, there is some compression on the breast with any mammogram. But ours is different in technology in that there is an arm on the machine that swings around. And what this arm does is it allows the radiology, the technologist, to take 1 millimeter pictures of the breast as the arm scans around.
It's like slicing a loaf of bread
Yes.
almost.
Now, are
It's
you
like-
all one of the centers that has this equipment? Are you one of the only ones?
So we were one of the first in the
Okay.
area and one of the first in the state to have this technology. And it has been made a huge difference in how we treat our patients in the center.
One of the things that I feel really strongly about with you all is you're very patient-centered, and Erin, I think as you get older, at least for me, getting results immediately is really important. Talk to us about that, because you're really proud of that.
Yeah, when we opened, one of the main goals of the hospital was to be more women-centric. Women drive the healthcare dollar, and they want to know what the results are at time of service. They want to come in and have that peace of mind when they leave. We don't give them a written report, but when the mammogram is finished, we go back, talk to the radiologist as he is reading their mammogram, and we can walk out and give them a verbal report.
Same day.
Same day service.
Amazing.
Which is huge. Now, for example, if it comes back suspicious, is there then protocol put in place?
There is. We have what's called an imaging navigator. She's certified in imaging navigation for the breast. And what she does is the technologist that does the mammogram will go notify this navigator, and she will bring the patient into a conference room. We show them their films. There are no secrets. We show them what the radiologist saw on the mammogram. Some abnormality. It could be a small lesion, it could be calcifications, but if they have been recommended for a biopsy, that navigator is going to take them to the next step. We require that any patient that has an abnormality in their breast see a surgeon. It
Makes
has
sense.
been a great standard of care for us because imaging is not perfect. And we have patients that come in that the physician may feel something, but we don't necessarily see it on imaging. So having that, we call it a safety net, see the surgeon, they can examine the breast because some cancers can feel different than normal breast tissue. And we have caught some cancers that way that didn't show up as suspicious on a mammogram.
What is the recommended age to begin a mammogram, and then what are the recommendations continuing and moving forward?
Okay. We follow the American College of Radiology and the American College of Surgeons recommendations, which is still yearly mammograms. We still see a lot of pathology even at 1 year, and so women should continue to get a mammogram as long as they're healthy.
Now, what about history? If you have a sister or mother, do you start then at a younger age? What is the age that is recommended?
So if you're high risk, that can vary as to which age you should start.
Okay.
Sometimes there's a recommendation for when you start doing breast exams.
Okay.
It might be around 16 to 20, right in there. And then come seeing a physician. So it varies based on risk. There are things such as genetic testing if you're high risk. So If you are BRCA positive, and when we say that, the Angelina Jolie story comes to mind. So her standard of care is going to differ from the woman with a normal health history.
Are you seeing disease present now with the younger generation more so, or is that?
So it depends on your risk in your family.
Okay.
So if you have a strong cancer history in your family, such as 2 or more women on one side of the family with breast cancer, a male breast cancer in the family, ovarian cancer, those are all things that indicate that you could be high risk for developing cancer at an earlier age. So when you have that history, women want to make sure that every time they go back and see their physician, they update their health history and talk to them about their risk.
How does someone go about booking
A
an
mammogram.
appointment? Well, you were going to ask that next.
So they can call our scheduling department, and that number is 843-522-5015. And our scheduling department can set them up to come in for a mammogram and come see us.
Relatively quickly? Is it
Yes,
difficult to get
relatively
in?
quickly.
What
And
can-
certainly,
I'm
go
sorry,
ahead.
not to interrupt, but what can people expect when they do come for their mammogram? What does the procedure look like from they walk in until it ends?
So the center was set up like a spa-like atmosphere.
Right, this is pretty cool.
So when you walk in, we have butterflies on
Right.
the wall, we have gourmet coffee.
Right.
And you're welcomed by one of our staff members. We get you registered, and then you're taken back, and we have beautiful mahogany doors in the room, and you get changed for your mammogram. We tell women try not to wear deodorant because the aluminum in the deodorant can show up on the film. And come in, and the staff member will take them into the 3D mammography room and perform the mammogram. Then once they're finished, they go back in the changing area and wait while the staff member gets their results, and they walk around and you get your results while you're there.
That's unbelievable.
Oh no, it really is not.
Is this why y'all are nationally recognized?
Exactly.
Yes, well, that's one of the many reasons. We're also recognized for our breast cancer care. So what we're talking about, getting mammograms and different things in breast, is more like what's called benign breast care, taking care of the healthy breast. But when women develop breast cancer, we're also
whole
nationally
nother-
recognized for our program.
Sure.
Oh, Jackie, it's been a treat to talk to you. It really is. Knowledge is power, isn't that
Knowledge
what
is
we
power.
always say?
Take
Thank
away.
you for joining us. We want to thank all of you for joining us here at Beaufort Memorial Hospital. Have a wonderful week.